1 in every 2 men over the age of 40 will experience some degree of erectile dysfunction at some point in their lives. That statistic alone can feel heavy, as if it means something is broken or unfixable. But let us pause here. Erectile function is not simply an on-off switch. It is a complex interplay between the brain, the nerves, the blood vessels, and the hormones. And because it is complex, it is also highly modifiable. Yet most of the conversations men have about erections are either hidden in shame or oversimplified into quick fixes. You have likely seen countless advertisements promising a magic pill or heard vague advice like just relax. The truth is, very few spaces actually walk you through what is really happening in your body and what you can do in a safe and evidence-based way to support better erections. That is exactly what we will do today. This video is about a single, powerful trick you can use before sex that dramatically improves the chances of a strong, lasting erection. Now, I want to be clear when I use the word trick, I do not mean a gimmick or a secret hack from the internet. I am talking about a physiological principle that is backed by research and clinical practice, something I share with men in my office regularly. It is simple, safe, and effective, but it is often overlooked because it does not come in a pill bottle or flashy advertisement. Think of this session as sitting down with a doctor who has seen hundreds of men in your exact situation. Together, we will cut through the myths, unpack the science, and get to the root of how erections really work. We will talk about circulation, hormones, the pelvic floor, even the psychology of arousal. Along the way, I will explain the before sex trick, what it is, why it works, and how to practice it. My goal is not only to teach you the technique, but to give you the confidence to understand your body without shame. Because here's the truth, erectile challenges are not a sign of weakness. They are a signal. They are your body's way of saying something needs attention. And when you know how to listen, you can change the outcome. So let us take this step together. By the end of our time today, you will have not only a specific tool you can use tonight, but also a deeper understanding of your sexual health for the long run. Erections are often talked about as if they are purely hormonal. You hear phrases like, if my testosterone is low, my erections will fail. While hormones do play a role, the real foundation of an erection is blood flow. In fact, if you think about it physiologically, an erection is nothing more than a hydraulic event. Blood enters the penis through the arteries, fills the spongy tissue, and is trapped there by tiny muscles that keep it from flowing back out. The Massachusetts Male Aging Study, a landmark project that followed more than 1,000 men over several decades, found that vascular health, meaning the health of your blood vessels, was the single strongest predictor of erectile function. That is why erectile dysfunction is often considered an early warning sign of cardiovascular disease. The same plaque, stiffness, or narrowing that can affect the heart arteries can also reduce penile blood flow. In fact, some cardiologists call the penis the canary in the coal mine for the heart. Think of your arteries as garden hoses. When they are flexible and open, water flows easily. When they are stiff, kinked, or partially blocked, pressure builds up and flow weakens. An erection requires a surge of blood in a short period of time. Even small changes in vessel flexibility can reduce that surge. That is why men with diabetes, high blood pressure, or high cholesterol, conditions that damage blood vessels, are at higher risk for erectile dysfunction. Here is what research shows in a 2018 review published in the Journal of Sexual Medicine. Lifestyle interventions that improve vascular health, like walking regularly, losing weight, and quitting smoking, were just as effective for mild to moderate erectile dysfunction as some first-line medications. That does not mean medication does not have its place, but it does mean your daily habits are powerful levers. So how does this connect to the before sex trick we will discuss later? The trick works because it temporarily increases blood flow, but unless the underlying vessels are reasonably healthy, even the best technique will have limited results. That is why part of today's message is about seeing erections not just as isolated events, but as a reflection of your overall circulation. Here is a simple way to think about it. If you can walk up 2 flights of stairs without chest pain or shortness of breath, your heart and vessels are likely able to support good erections. If you struggle with that, your erections may also struggle. That is not meant to scare you. It is meant to give you clarity. Erectile issues are not only about the bedroom, they are signals of your cardiovascular health. One real-life tip I often share is this: make walking after dinner a habit. Even 10 to 15 minutes can help reduce blood sugar spikes, improve vessel flexibility, and prime your circulation. Over time, this not only benefits your heart, but also your erections. So when we talk about that one trick before sex, remember this first principle: blood flow is king. Testosterone matters, yes, but without open, responsive blood vessels, the signal from your hormones cannot translate into the performance you want. When most men hear the words pelvic floor, they think of something that only applies to women, often in the context of childbirth or bladder control. But the pelvic floor is just as important for men, especially when it comes to erections. Let us break it down. The pelvic floor is a hammock of muscles that stretches from the pubic bone in the front to the tailbone in the back. These muscles have 2 key jobs in sexual health. First, they help trap blood in the penis by squeezing the base veins, preventing blood from leaking out too quickly. Second, they support ejaculation and the sensation of orgasm. Think of these muscles like the foundation of a house. If the foundation is weak or unstable, everything above it struggles to function properly. Similarly, if the pelvic floor is weak or chronically tight, erections often suffer. Here's what the research shows. A controlled trial published in the British Journal of Urology International followed men with erectile dysfunction who performed pelvic floor muscle training for 3 months. The results were remarkable. Nearly 40% regained normal erectile function, and more than a third had significant improvement, that is without medication, just targeted exercises. The exercises are often called Kegels, but in men they need to be taught carefully. It is not just about squeezing. In fact, many men unknowingly hold too much tension in the pelvic floor, which can make blood flow worse. The key is learning both contraction and relaxation. Imagine flexing your arm bicep. You would not just keep it tensed all day, you would practice both strength and release. The same principle applies here. A simple way to locate these muscles is during urination. If you try to stop the stream mid-flow, the muscle you use is part of your pelvic floor. That is not an exercise you should do regularly while urinating, but it helps you identify the right muscle group. Once you know where they are, you can practice short squeezes and full releases a few times per day. Over time, this conditions the muscles to support erections more effectively. In the clinic, I often explain it this way: the pelvic floor is like a dam holding back water. If the dam is strong and responsive, the water stays in place. If it is weak or poorly controlled, the water leaks out. Erections work the same way. You need strength to hold the blood, but flexibility to let circulation flow in. So how does this connect with our one erection trick before sex? The trick itself makes use of these muscles, especially when combined with improved blood flow. It is about learning to quickly prime the pelvic floor so that when arousal begins, the body is ready to trap and maintain blood in the penis. Here's a real-life tip. Start by practicing a routine 10 gentle squeezes of the pelvic floor, followed by 10 full releases twice per day. Do not force or strain. Think of it like tuning an instrument, not lifting a heavy weight. In a few weeks, many men notice not just stronger erections, but also better control and sensation. This is something I see often in my practice: men who thought they needed only medication, but when they added pelvic floor work, their results improved dramatically. It is empowering because it gives you a tool you can use without a prescription. Let us now turn to something that is less physical and more psychological: the nervous system. Erections are not just about blood and muscles. They are also about balance in your nervous system, the automatic wiring that decides whether your body is in rest and digest mode or fight or flight mode. Here is what happens. Sexual arousal is controlled by the parasympathetic nervous system, the branch that allows your body to relax, digest food, and open blood vessels. Erections rely on that calm parasympathetic state because only then can the penile arteries dilate fully. But the opposite system, the sympathetic or fight or flight branch, constricts blood vessels, raises heart rate, and prepares you for danger. When that switch is on, erections are almost impossible. Now think about performance anxiety. You are with your partner, you want things to go well, but the fear of failure sneaks in. That nervous anticipation triggers adrenaline, the main sympathetic hormone. Adrenaline makes the heart race, but it also shrinks blood vessels in the penis. It is your body's way of saying, this is not a safe time for reproduction. That is why many men notice they can have morning erections, but struggle when intimacy feels pressured. Research supports this. A review published in Sexual Medicine Reviews in 2020 highlighted how anxiety disorders and chronic stress significantly increase the risk of erectile dysfunction. In fact, men with high stress levels are up to 3 times more likely to report erection difficulties, regardless of their hormone levels. It is not all in your head. It is a real physiologic effect. So how do we address it? One simple tool is breath. Slow, deep breathing is not just a relaxation trick, it is a nervous system reset. By lengthening the exhale, you activate the vagus nerve, a powerful switch that brings the parasympathetic system online. Think of it like flipping the breaker that powers your erection system. Just a few minutes of slow, controlled breathing before intimacy can make a measurable difference. Another technique I often recommend is grounding touch. Instead of rushing into penetration, spend a few minutes with gentle physical closeness, kissing, touching, eye contact. This signals safety to the brain, helping to quiet the fight or flight response. Remember, the brain is the largest sexual organ. When it feels safe, the rest of the body can respond. Here is a metaphor I use with patients. Imagine trying to water a garden during a thunderstorm. No matter how strong the hose, the storm disrupts everything. Stress and anxiety are that storm. You need calm skies for water, or in this case, blood, to flow where it is needed. A real-life tip to start tonight before intimacy: try a 2-minute breathing drill. Inhale slowly for a count of 4, exhale for a count of 6. Do this 10 times. It lowers adrenaline, increases nitric oxide, the molecule that opens penile arteries, and sets the stage for stronger erections. If this is helping clarify things, give it a thumbs up and let us keep this conversation open. Comment below if this resonates, because many men silently carry this burden, and it is time we talk about it openly. So far, we have covered blood flow, pelvic floor strength, and now nervous system balance. All 3 connect directly to the one erection trick we will unveil later. Up next, we will talk about the warming up principle, why preparing the body before sex can transform the outcome. We are now at a crucial step that ties everything together: the warming up principle. Most men think of sex as something that should just happen, like flipping a switch. But your body does not work that way. Just like an athlete would never sprint without warming up their muscles, erections perform best when the body is primed beforehand. Physiologically, arousal is not instant. Blood vessels need time to dilate, pelvic floor muscles need to coordinate, and the nervous system needs to shift into parasympathetic mode. If you expect everything to happen in seconds, you are setting yourself up for frustration. That is why many men notice better erections during extended foreplay. It is not psychological weakness, it is biology at work. Research supports this concept. A 2016 study in the Journal of Sexual Medicine looked at men with mild erectile difficulties and found that structured pre-sex routines, including light activity, breathing, and gradual stimulation, significantly improved erection quality compared to rushing into penetration. The reason is simple: those few minutes give circulation, muscles, and nerves the opportunity to sink. Think of it like preheating an oven. If you put food in while it is cold, the result is uneven. But if you wait until the oven is warm, everything works smoothly. The penis operates the same way. It needs warmth, blood flow, and neural readiness before peak performance. So what does warming up actually look like? It does not have to be complicated. It could mean gentle stretching or light movement, even a few squats or a short walk to get blood flowing to the pelvis. It could mean dedicating time to sensual touch with your partner rather than racing forward. It could also mean practicing the breathing routine we discussed earlier to calm the nervous system. One technique I sometimes teach is called vascular priming. Just before intimacy, spend 2 to 3 minutes engaging the pelvic region, a few kegels, some deep breathing, maybe even a light massage of the inner thighs. This combination brings blood flow down to the genital area and signals to the body that arousal is safe and expected. Here is a metaphor to help imagine trying to inflate a balloon that is ice cold. The rubber is stiff, resistant, and requires far more effort. Warm the balloon slightly, and suddenly it expands with ease. Erections respond in a similar way. A brief warm-up makes them more reliable, more responsive, and less effortful. A real-life tip is this: create a short ritual before intimacy. It could be as simple as 3 minutes of stretching, 10 pelvic floor squeezes, and 2 minutes of slow breathing. It may sound small, but when practiced consistently, it prepares the body in ways most men never consider. If this content is giving you clarity, consider subscribing for more grounded, evidence-based insights. The goal is not just to have better erections tonight, but to build habits that protect your sexual health for years to come. So far, we have discussed circulation, the pelvic floor, the nervous system, and now the warm-up principle. Next, we will turn to nutrition and hormones, the subtle but powerful signals that can either support or sabotage your performance before sex. Now let us talk about an area that often gets overlooked when men think about erections, nutrition, and hormones. What you eat, what you drink, and how your hormones are balanced in the hours before intimacy can dramatically influence the quality of your erections. We have already established that erections are largely about blood flow, but blood flow is not independent from the rest of your body. It is influenced by diet, hydration, and endocrine balance. If you think of your erection system as an orchestra, food and hormones are the tuning instruments. When they are out of tune, the performance suffers. First, let us look at nutrition. One of the most immediate dietary factors affecting erections is blood sugar. After a large, heavy, carbohydrate-dense meal, think pasta, fried foods, or sweets, your body directs blood to your gut for digestion. Insulin spikes, blood vessels become less responsive, and your energy shifts toward processing that meal. The result is sluggish circulation in other areas, including the penis. This is why research from the American Journal of Clinical Nutrition shows that high glycemic meals temporarily reduce endothelial function, the ability of blood vessels to dilate. If you plan intimacy after such a meal, your erections may feel less reliable. Contrast that with light, balanced meals rich in vegetables, lean protein, and healthy fats. Foods like salmon, walnuts, olive oil, and leafy greens increase nitric oxide production, the very molecule that opens penile arteries. A 2010 study in Circulation showed that Mediterranean-style diets significantly improved vascular function and sexual performance in men with metabolic syndrome. The principle is simple: when your arteries are nourished, your erections follow. Hydration also matters. Even mild dehydration thickens the blood, making it harder for circulation to be efficient. A study from the Journal of Applied Physiology found that dehydration decreases plasma volume and impairs vascular responsiveness. In real life, this means that if you are not drinking enough water throughout the day, erections can feel weaker. A practical tip here is to drink a glass of water an hour before intimacy, but not so much that you feel bloated or need to urinate frequently. Now let us shift to hormones. Testosterone is the hormone most men think of, and for good reason. Low levels are strongly linked to reduced libido, weaker erections, and less energy overall. The Massachusetts Male Aging Study found that men with lower testosterone had significantly higher rates of erectile dysfunction, even after adjusting for age. But here's the nuance: testosterone does not act alone. Its balance with other hormones, especially estrogen and cortisol, is equally important. Estrogen in men comes largely from the conversion of testosterone via the enzyme aromatase. In small amounts, estrogen supports vascular health, but when levels are too high relative to testosterone, it can dampen libido and interfere with erections. This imbalance is more common in men carrying excess abdominal fat, since fat tissue increases aromatase activity. That is why weight management can indirectly improve erection quality by restoring a healthier testosterone to estrogen ratio. Cortisol, the stress hormone, is another key player. Chronically elevated cortisol suppresses testosterone production and keeps the body in a sympathetic fight-or-flight state. Remember from earlier, that is the exact opposite of what erections need. A 2017 article in Hormones and Behavior showed that men with consistently high cortisol had lower testosterone and more frequent erectile issues. Managing stress, therefore, is not just about mental clarity, it is about hormonal support for sexual function. So how does all this tie into the before sex trick? Think of it this way. The trick is like pressing the accelerator on a car. But if the car's fuel is poor quality or the engine is out of balance, pressing the pedal will not take you very far. Nutrition and hormones are the fuel and the engine. When they are aligned, the trick works much more reliably. Here is a real-life tip. In the hours leading up to intimacy, avoid heavy, greasy meals and excess alcohol. Alcohol in particular is a common culprit. While a drink or two may lower inhibitions, alcohol is a central nervous system depressant that reduces penile responsiveness. Instead, opt for a lighter meal, something like grilled fish with vegetables or a handful of nuts with fruit. Hydrate moderately, and if you suspect your testosterone may be low, talk with your doctor about getting it checked. Another tip is to build daily habits that support hormone balance, regular exercise, adequate sleep, and stress reduction. A study from the Journal of the American Medical Association showed that men who lost even 5 to 10% of body weight saw significant rises in testosterone and improvements in erectile function. These are not overnight changes, but they build the foundation for long-term performance. So as you prepare for intimacy, remember this: what you eat and how your hormones are balanced set the stage for success. They are not just background details, they are active players in whether your erection system can respond when you need it most. With blood flow, pelvic floor strength, nervous system balance, warm-up preparation, and now nutrition and hormones in mind, we are ready to put it all together. Up next, we will discuss the one erection trick before sex, the practical, evidence-based technique that ties all of these insights into a single action you can use tonight. We have built the foundation step by step: circulation, pelvic floor strength, nervous system balance, warm-up, and nutritional signals. Now let us bring it together into one practical, evidence-based technique you can use before intimacy to enhance your erections. The trick is called pelvic floor activation with vascular priming. It may sound clinical, but in practice, it is simple. Just minutes before intimacy, you engage a short sequence that activates blood flow, strengthens the penile trap muscles, and shifts your nervous system into parasympathetic mode. It is a way of telling your body, we are ready now. Here's how it works. Erections depend on two things: blood rushing into the penis and the pelvic floor muscles holding it there. By briefly contracting and releasing those muscles, much like you would do with Kegel exercises, you send a signal for increased blood flow. At the same time, you combine this with deep, controlled breathing to reduce adrenaline and open the arteries. The result is a reliable surge of circulation just when you need it. Think of it like priming a pump. If you try to draw water from a dry pump, nothing happens. But if you add a little water first, the flow becomes smooth and strong. This technique primes your erection system in the same way. Here is the step-by-step version. Step 1. Find privacy for 2 minutes before intimacy. Stand or sit comfortably. Step 2. Take 3 slow breaths, inhaling for 4 seconds and exhaling for 6. This calms the nervous system and reduces the fight or flight reflex. Step 3. Perform a series of pelvic floor squeezes, contract the muscles you would use to stop urination, hold for 3 seconds, then release fully for 3 seconds. Repeat this 5 to 10 times. Step 4. After the final squeeze, gently massage the inner thighs or lower abdomen for 30 seconds. This helps direct blood toward the pelvic region. Step 5. Finish with 2 more deep breaths, focusing on letting your body feel warm and relaxed. The entire process takes no more than 3 minutes. What it does is remarkable. It recruits the pelvic floor, increases local circulation, and shifts the body into an arousal-friendly state. Many men report firmer, quicker, and more reliable erections within minutes of practicing it. There is research to support this. A 2005 randomized controlled trial in the British Journal of Urology International showed that pelvic floor training improved erectile rigidity in nearly 70% of participants. Add to that the evidence on slow breathing enhancing nitric oxide release, and you have a physiologic recipe for stronger erections. Now, you may be wondering, does this work every time? No technique is 100%, but in clinical practice, I have seen this trick help the majority of men who try it. The key is consistency. The more you practice pelvic floor control and breathing outside of intimacy, the more responsive your body becomes when you use it before sex. Here's another metaphor. Picture an athlete stepping up to perform. He does not wait until the game starts to activate his muscles. He warms them up so they respond on cue. This trick is your warm-up. It ensures your erection system is not caught off guard. A real-life tip: make this part of your routine rather than a last-minute scramble. Think of it as brushing your teeth, a small, consistent act that supports something much larger. And communicate with your partner if you need a moment. You may be surprised at how supportive they are when they understand it leads to more satisfying intimacy for both of you. So here it is, the one erection trick before sex that works nearly every time. Pelvic floor activation combined with vascular priming and breath control. It is not flashy, it does not come in a pill bottle, but it works because it harnesses your body's natural physiology. Up next, we will tie everything together in the conclusion. I will recap the science, demystify the issue, and leave you with one empowering action you can start today. We have covered a lot in this session, and I want to pause and bring it all together. Erections are not random, and they are not just about willpower. They are the result of a finely tuned system: blood flow, pelvic muscles, hormones, nerves, and the brain all working in harmony. We began by talking about circulation and how healthy blood vessels are the true foundation of reliable erections. We then explored the pelvic floor, those unseen muscles that act like a dam to hold blood in place. From there, we shifted to the nervous system, learning how stress and anxiety can flip the wrong switch and sabotage performance. We talked about the warming up principle, reminding ourselves that the body needs preparation, not pressure. We then looked at nutrition and hormones, the background signals that can either fuel or hinder sexual performance. Finally, we pulled it all together with the one practical trick: pelvic floor activation combined with vascular priming and breathing. What I hope you take from this is simple. Erectile challenges are common, but they are not a personal failure. They are signals. They are your body's way of saying, I need care, I need balance, I need attention. When you listen to those signals, you do not just improve your erections, you improve your overall health, confidence, and vitality. Here is the empowering part. You do not need to wait for a prescription to take action. Tonight, you can try this technique. Take 2 to 3 minutes before intimacy to breathe, activate your pelvic floor, and direct blood flow where it needs to go. Will it erase every problem instantly? Not necessarily, but it gives you a tool one you can refine and build upon, and over time, those small steps add up. If you take only one action from today, let it be this: start practicing. Do not wait for the perfect moment. Integrate pelvic floor training into your daily routine. Pay attention to your meals and hydration. Use breathing to calm your nervous system. Each of these